Have you ever felt an itch that just would not go away? And wondered if your body was trying to tell you something deeper? Many people think of itching as a small annoyance. Maybe dry skin, maybe laundry soap. But for older adults, a persistent itch in very specific places can sometimes be an early signal of something far more serious, even cancer. In this video, we will uncover 5 common itchy spots that doctors and researchers have connected with certain cancers, and we will talk about why those spots matter, what is happening inside the body, and how you can tell the difference between a passing irritation and a possible early warning sign. By the end of this video, you will not only know where to pay attention, but also what questions to ask your doctor and what steps you can take if the itch just will not stop. Remember, this is not about fear, it is about awareness. Because the earlier you notice quiet signs, the better your chance of protecting your health. Let us begin. Sign 1. Persistent itching on the lower legs. When an older person begins to experience a deep, restless itch on the lower legs, especially the shins or calves, with no rash, no bug bites, and no new soap or lotion, it can sometimes be connected to blood-related cancers, especially lymphoma. The reason is this. Lymphoma cells release inflammatory chemicals into the blood. Those chemicals irritate nerve endings, and one of the most common results is a deep, unrelenting itch that often gets worse at night. Let me share the story of Harold, an 82-year-old retired carpenter. For nearly half a year, his only complaint was a constant itch on his legs. No lotion helped, no detergent change made a difference, and even his dermatologist thought it was eczema. But when blood tests finally showed abnormal white blood cell counts, scans revealed lymphoma in his chest. Harold often said later, "The itch came before everything else." Not every itchy leg means cancer, but the key is persistence and lack of visible cause. If there is no rash, no dryness, and it lingers for weeks, especially if there are other subtle signs like night sweats or unexplained tiredness, it is worth asking your doctor for deeper tests. Sometimes the body whispers long before it shouts. Sign 2. Itching. Between the shoulder blades, a second spot that has raised concern in many seniors is the upper back, right between the shoulder blades. People often blame posture, dry air, or an old shirt tag, but this kind of itch has been linked again and again to pancreatic issues. Why the back bouty? Because when tumors in the pancreas block the bile ducts, bile salts build up in the bloodstream, and those salts irritate nerve endings in the skin, especially in the dense nerve network of the back. Margaret, a 74-year-old librarian, described it as a phantom itch. She tried back scratchers, creams, even changed mattresses, but nothing worked. Months later, routine blood work showed abnormal liver enzymes. Imaging then revealed a small tumor pressing on her bile duct. Her itch was the very first sign. This does not mean every back itch is cancer, but if the sensation is deep, constant, and does not improve with normal skincare, and especially if it comes with darker urine, pale stools, or unexplained fatigue, it deserves medical attention. Your skin may be the messenger of what is happening deep inside. Sign 3. Itchy scalp without flakes, an itchy scalp. Sounds harmless, but when there are no flakes, no redness, and no dandruff, and when the itch feels more like tingling or burning than simple dryness, it can sometimes point to leukemia or other blood conditions. For example, Dennis, a 76-year-old former teacher, said his scalp tingled every afternoon. He thought maybe his hat was too tight. He changed shampoos, but nothing worked. Finally, blood work for unrelated fatigue showed high white blood cell counts. The diagnosis was early-stage chronic leukemia. His scalp had been the only messenger. The difference here is resistance. Ordinary dry scalp usually improves with moisturizers or medicated shampoo. Cancer-related itch simply does not respond. It lingers, it moves around, it nags. And because older adults often already have some dryness, it is easy to dismiss. But if nothing helps for weeks, and you also feel more bruised or unusually tired, it is time to ask questions. Also, do not forget skin cancers of The scalp. They can start as a small itchy patch, sometimes hidden by thinning hair. If you feel an itch in the same place over and over, ask someone to take a look, whether a spouse, a hairdresser, or a caregiver. Sign 4. Localized itching on the chest or breast. This is especially important for older women, but it also matters for men. Persistent itching around the nipple or under the breast, without relief from lotions, can be an early sign of inflammatory breast cancer or tumors near the chest wall. The skin may feel thicker, warmer, or slightly rough. Sometimes there is redness, sometimes nothing at all. Only the itch. Take Helen, a 68-year-old grandmother. She tried switching bras, detergents, even stopped wearing bras for a while, but the itch stayed in the same place day after day. When she finally asked her doctor, scans revealed a small aggressive tumor just under the skin. No lump, no pain, just an itch that would not stop. For men, this can be even easier to miss. Male breast cancer is rare, but reals, an itchy patch near the nipple, a tiny area of thickened skin. These should not be ignored, and remember, sometimes the cause is not the breast tissue itself, but enlarged lymph nodes nearby. The key point is this: persistent localized itching on the chest area is worth a doctor's eye. Sign 5. Itching in the anal or genital region. This is the most uncomfortable to talk about, but also one of the most important. Chronic itching in the anal or genital area, with no clear cause like hygiene or infection, may sometimes be linked to anal, vulva, or penile cancers. Because it is embarrassing, many people stay silent. But silence can be dangerous. Consider Robert, a 75-year-old widower. He thought hemorrhoids were causing his itching. He used creams, cold packs, even changed diet. For nearly a year, nothing worked. Finally, a specialist found a small tumor inside the anal canal. Early stage, but it explained everything. Women face similar risks. Vulva cancer, though uncommon, becomes more frequent after 60. Its first sign is often not a lump, but relentless itching that does not respond to creams or moisturizers. The lesson is simple. If the itch is one-sided, persistent, and feels more raw than surface level, bring it up. No embarrassment is worth missing an early diagnosis. Final thoughts: your body is always communicating, sometimes with pain, sometimes with fatigue, and sometimes with something as small as an itch. The lower legs, the upper back, the scalp, the chest, and the genital region, these are not random spots. They are places where the body often begins to send its first quiet warnings. You do not need to panic. Most itches are harmless, but awareness can save lives. If something does not improve, if it lingers week after week, speak up. Ask questions. Demand answers. Remember, catching something early is never about fancy machines first. It is about noticing what is small and persistent and respecting your own instincts. So tell me in the comments, which of these 5 signs surprised you most? And will you pay closer attention to an itch that will not go away? Thank you for watching. And if you found this video helpful, please like, subscribe, and share. Your support helps us keep creating content to inform and inspire you.